Hi, I'm Dr. Michael Gartner. I'm a board-certified plastic surgeon, and I'd like to introduce to you today a revolution in liposuction called laser liposuction, otherwise known as Smart Lipo. This new procedure allows patients to recover much quicker, 2 to 3 days, back to full activity, working out, or anything you want to do with minimal downtime, minimal discomfort, and minimal swelling and minimal black and blue. Doesn't even necessarily need stitches at the time. Next, you'll see a patient having the procedure performed comfortably. That some of them are actually on a cell phone reading a magazine while I'm performing the procedure because it's so comfortable. And then you'll also see them 3 days later after the surgery and what they look like. Seeing is believing, and this video will show you how comfortable and how easily the process is.
My name is Frankie Miranda.
Okay, here we go.
I'm 37 years old. I got a Smart Lipo in my abdomen and love handles. I was very happy with the results that I was accomplishing at the gym. However, the midsection kept staying the same. It was a very stubborn area to work out, and that's why I decided to look for an alternative, and that's how I came across with the procedure through Dr. Michael Gartner.
Alright, so we're here today to show you how the new Smart Lipo laser liposuction works. It's a fantastic new revolutionized technology, the latest in liposuction, which gives better skin tightening, less recovery because it gives less bruising, less swelling. And we're here today to show you how it works. It can be done under local anesthesia in a very comfortable way. So here we go, come on in. First step is we have the patient here. He's all prepped. We have him numbed up. We're just going to make a little incision here in the skin. Sorry about that pinch right there. Incision right there. Okay. And right here. Okay so far, Frankie?
Yep.
Alright, fantastic. Alright, so after we have the patient prepped and draped, we made a few more small little numbing areas for the small little needle sticks. Now we just have to put in the numbing medication. So that way everything's going to be nice and numb. He's not going to feel anything. Alright? You just might feel a little bit of pressure. The medication goes in a little bit. You good? Alright. Fantastic.
It's a little bit of a weird sensation, and I'm not feeling any pain.
Underneath the skin, you have less pain fibers. So all what you really feel is a little bit of pressure. Every once in a while, you might feel a slight ooch, but it's very, very tolerable, as you can see. The nice thing under local anesthesia, you avoid a lot of the problems of general anesthesia, like having a lot of nausea, and all the complications that possible general anesthetic can give.
It's a little pressure and, you know, a weird sensation. Something that you are not used to, that's why. No pain.
Good. Once the fat's gone, it's gone forever. Alright, so now we're done with the numbing part. That's the first step. And now we're going to fire up the laser and tighten the skin and destroy the fat cells.
I am stunned how comfortable I'm feeling, and it, aside from the different feeling of having the needle coming in, but it doesn't hurt at all. Absolutely. Totally.
So here's the laser itself. It's a fiber optic wire, very fine tip to it. It's roughly a millimeter to 2 millimeters coming out. Okay, that little red light at the end shines a little light, so you can always see where you are at all times, making the procedure very, very safe. Gives the surgeon access to know exactly where he is at all times. Right now I'm going deep, just to treat melt the fat deeply. And then we're going to go a little bit more superficially underneath the skin to heat up the skin, get some nice skin tightening. How you doing, Frankie? Any problems?
Absolutely fine. I'm not feeling anything. I'm pretty relaxed.
This differs a little bit from traditional liposuction in that it causes heat underneath the skin, shrinking the skin, and breaking up the fat cells, which basically you'll get almost no black and blueness, you get less swelling, so it's a quicker recovery, usually 2 to 3 days. You might have a little soreness, but you can go back to your daily job in 2 to 3 days with almost no black and blueness, less swelling. Okay? Get back to work, and it can be done, as you see, very comfortably under local, and that avoids the risks of anesthesia, having the nausea, vomiting afterwards, and all the other risks that going under an anesthetic can cause. So it has great advantages over traditional liposuction. So now we just take this little liposuction cannula here, okay, very small, okay, and then we're just going to go around and get some of the liquid out and some of the grease that's been heated up, fat. And once it's out, it's gone forever.
There goes the French fries and the burger. Look at that. Hi, how you doing? Good. I'm just getting my procedure done right now. It doesn't hurt at all. Yep. So I'll be done in probably an hour. Okay? See you later. Bye. She was the one that I saw the other day, Demi Moore.
Yeah?
On the...
You saw Demi Moore the other day?
No, and on the Video Music Awards.
I see.
She looks incredible.
Well, she's married to a guy 20 years younger.
Yeah. She is.
Which is pretty incredible too. He is incredible too.
You know what's incredible? You have a needle up your stomach and you're reading a magazine. That's incredible.
When I can come back to the gym?
Next week?
Next week?
Monday if you want. Oh, Monday or Tuesday. You might be a little sore the first week, but theoretically you can go back to the gym. For this, there are no cuts. Really, it's just since there are no cuts.
So I can do aerobic exercise and weight training
If you
too?
you might have some soreness, but you can do it. There's no limit. There's no limit.
And I am planning to fly out to Puerto Rico next Friday. That would not be a problem
You
either.
could fly out tonight if you want to. Okay, here we are after finishing our procedure. How do you feel, Frankie?
I'm feeling great. I'm not feeling any pain. It was actually much better and painless than I ever thought.
Did you have any pain throughout the whole thing?
No, it's just getting used. It's basically getting used to the instrument. It's a weird sensation at the beginning, but after 15 minutes, you are completely used to it.
All right, you're all done, and now you're looking slim. Now the fat's gone, it's gone forever. Okay, so Frankie, here we are 3 days later after your Smart Lipo procedure of doing your lower abdomen, your waist. How you feeling?
Fantastic. I just felt a little bit of soreness, but it was more like I went to the gym and I did a few abs.
Yeah.
And that's all. That's all.
Yeah.
I took the painkillers just as a preventative measure, but I really never needed to take them. So I just took them for the first 2 days, and right now I'm not taking any painkillers.
All right, fantastic. And you're walking around, doing things?
I went to work. I walked around the house the first day. I actually went and bought food outside, takeout, went back home, had food, and then I rested for the first day. And then the second day I was again moving around. Nothing prevented me from doing any kind of movement or daily activity.
Okay. All right, so what do you say we take a look? Why don't you stand up? All right, very good. And I see immediately you're flatter right away here. I see virtually no real black and blueness here. Let's take a look at the other side here. Okay. And you still have a little bit of swelling here, but you're flatter here, and you have some virtually no black and blueness. Fantastic.
If you have a very specific problem in a very specific area that really doesn't require major surgery, but it's just that little spot that bothers you, this is the alternative.
Smart Lipo or laser liposuction is one of the many procedures I do that give you minimal downtime and get you back to work as soon as possible. If you're interested in discussing more, I offer free consultations, or look at my website, GartnerPlasticSurgery.com. If you want to give us a call, make an appointment, the number is 201-546-1890. So thank you for watching, and I look forward to meeting with you in the future.